sponsors Dominion Energy, Virginia Housing, and AARP Virginia. This webinar series would not be possible without the support of these 5 wonderful organizations. So thank you so much. As we start to move into 2021, we've received several questions about what will the conference look like in 2021, and we have some exciting news to share with you guys. We are going virtual, as many conferences have in the past 10 months. We are following the trend in efforts to keep everyone safe and healthy and make this programming really accessible to not only those who are interested across the Commonwealth, but those supporters and attendees of our webinar series that we've gained over the past several months. We've had people from all across the country join us each month for this programming, and we're just thrilled at the opportunities to spread some of this programming even further than just across the state of Virginia. So as we move into the next couple of months and start planning and really shaping what that conference is going to look like in May of 2021, if you're interested in the planning process or supporting the conference, all those opportunities are available. You can reach out to me directly, martina@vgcoa.com, for more information on that. Volunteers and sponsors are what make this conference possible. So in advance, we appreciate you and thank you and look forward to hearing from you. As we get started today, we want to thank you for joining us for the Virginia Nutrition Programs Aligning with Virginia's Roadmap to End Hunger program this month. Our presenter is Kelly Wright, and we're going to touch on how the current and federal state nutrition programs align with the governor's roadmap to end hunger. Kelly will focus on senior nutrition programs, and we'll take a deeper dive into senior hunger and the spotlight integral programs to address hunger in our communities. A little bit of background on Kelly before I hand it over to her. As a registered dietitian, Kelly has worked in community nutrition for her entire career. In her current role as a nutrition program coordinator at Virginia's Department for Aging and Rehabilitative Services, she coordinates the Senior and WIC Farmers Market Nutrition Program, while also providing technical assistance to the 25 area agencies on aging, congregate and home delivered meal programs. Previous to this position, Kelly has worked in state and local government and several nonprofit agencies. She has held leadership positions at WIC, Head Start, and the Food Bank of Central New York. Before becoming a dietitian, Kelly owned and operated River Edge Mansion Bed and Breakfast, where she hosted numerous overnight guests from all over the world. Besides being the innkeeper, she was also a caterer, serving fresh, locally grown foods to her guests at business meetings, weddings, and other special events in this historic home, which was built in 1818. In her spare time, Kelly enjoys being out in the sunshine, playing tennis, swimming, and traveling. So with that, Kelly, I'm going to hand the screen over to you and let you get started. Well, actually, let me do one thing real quick. I forgot my usual housekeeping announcements. We will do questions at the end for those of you that have joined us before. You know that we'll hold questions till the end, but you're encouraged to put your questions in the Q&A box at the bottom of your screen. You'll see a chat box, a raise hand box, and to the right of that, 2 little bubbles that say Q&A. I encourage you to put your questions in that Q&A box, and we'll take those questions live at the end. And what the process will be is I will actually call on the person who has typed in the question. And if you have the ability, you can turn on your camera and unmute yourself, and we'll allow you to ask your question live. So I'll look forward to engaging with our attendees at the end and letting them ask Kelly some questions about her presentation. So with that, now, Kelly, I'll hand it over to you.
Thank you, Martina. And let's see from the beginning. There we go. Hello, everyone. Good afternoon. Thank you so much to today's conference partners and sponsors for inviting me here. I hope you are all staying safe while staying socially connected. As Martina mentioned, we're going to take a deeper dive into senior hunger and spotlight integral programs that address food insecurity in our communities. So today's objectives include an overview of the roadmap to End Hunger as it relates to the aging population, government-funded nutrition programs, and the impact of COVID-19. And we're going to get thinking about how to align the current nutrition programs to advance the goals and strategies of the roadmap to end hunger. So who created the governor's roadmap to end hunger? It was created by the Nutrition and Food Security Work Group within the governor's Children's Cabinet to develop goals, identify strategies, and make comprehensive recommendations to the governor that will expand access to nutritious food and decrease food insecurity. The Nutrition and Food Security Work Group was gathering momentum throughout 2018 and 2019, and DARS was included in the work group as the administrator of the Senior and WIC Farmers Market Nutrition Program. Then, in the wake of COVID-19, a state feeding task force was convened to provide coordination of Virginia's emergency response efforts to address the increased demand for food and to address the food supply chain disruptions in the communities across the Commonwealth. With the input of this task force and the momentum already occurring with the Nutrition and Food Security Work Group, the Roadmap to End Hunger was born. So what is the governor's roadmap to end hunger? It is a unified set of goals and strategies to prioritize food security during the current public health emergency and beyond. The roadmap to end hunger illuminates a pathway to improve food access for all Virginians through programmatic and policy solutions. This 26-page resource was released on October 20th, 2020. In it, you will find 8 overarching goals and strategies, plus an additional top 10 by the year 2025 list. I will be referring to them both today. I encourage you all to plug in Virginia Roadmap to End Hunger into your favorite search engine to download the PDF and learn more about this important initiative. Although all 8 of the goals and strategies of the Roadmap to End Hunger are merited, today's focus will be on the following goals and strategies as they relate to the aging population. Increase nutrition support for seniors, increase participation in the Supplemental Nutrition Assistance Program, otherwise known as SNAP, and the Women, Infant, and Children Program, otherwise known as WIC. Amplify public awareness of hunger in Virginia and support information sharing across public and private sectors. Support community organizing to combat food insecurity and hunger. Grow access to local food for families. Strengthen connections between food access programs and the healthcare sector. And encourage food and agriculture investments in food deserts and marginalized communities. In addition to the goals and strategies highlighted on the previous slide, here are 5 of the Roadmap to End Hunger's top 10 by 2025 list that refer to the aging population. These aspirational goals represent our greatest opportunities to reduce food insecurity over the next 5 years. The SNAP participation rate will increase by 90% of eligible individuals or higher. Virginia Fresh Match and the WIC and Senior Farmers Market Nutrition Programs will be available at all highly accessible, high-need farmers markets. Virginians will have streamlined access to food security information and benefit programs. Evidence-based nutrition education programming will be made available to food insecure families in all regions of the Commonwealth. And home-delivered meals for seniors and people living with disabilities will be provided as a Medicaid-covered service. So now that we know a little more about the Roadmap to End Hunger, let's take a look at the data on senior hunger. The United States Department of Agriculture, or USDA, defines food insecurity as a lack of consistent access to enough food for an active, healthy life. More than 5.3 million seniors in the United States, or 7.3% of the national senior population, were food insecure in 2018. According to Feeding America's Map the Meal Gap report, 842,870 Virginians experienced food insecurity in 2018, which translates into a rate of 9.9% food insecurity in the Commonwealth. For Virginia's seniors in 2018, the rate of food insecurity was 7.4%. Feeding America estimates that an additional 447,000 Virginians are experiencing food insecurity as a result of the COVID-19 pandemic, increasing the Commonwealth's food insecurity rate from 9.9 to 15.1% annually, which is a 5.2% increase. In Virginia, 69.4% of all households said that it was often or sometimes true that they worried whether their food would run out before they had money to buy more. So pulling a data comparison from 2019 to 2020 on our DARS assessment form for the seniors in our congregate and home delivered meal programs, we saw a 7% increase in that similar question of, I don't always have enough money to buy the food I need. So just in that short time, we saw that increase significantly. As would be expected, food insecure seniors are 2.33 times more likely to report being in poor or fair health compared to food secure seniors. This is more than double the rate of food secure seniors, which also translates into increased hospitalizations and a higher need for skilled nursing care. So reduced intake of calories and nutrients equals an increased risk for malnutrition, increased risk for chronic disease, increased risk for depression, increased risk for activities of daily living impairment, and increased healthcare costs. These multiple chronic health conditions can reduce a person's ability to bathe or dress themselves or to shop and prepare meals. Health, functional, and income limitations may lead to coping strategies such as eating less food or the wrong kinds of food, or making trade-offs between buying food or medications. In turn, these poor health outcomes may increase healthcare expenditures and the risk of long-term care facility placement. So the difference between food insecurity and malnutrition, as mentioned earlier, food insecurity is the lack of consistent access to enough quantity of food for an active, healthy life. So food insecurity can lead to malnutrition. However, people who are food secure can also be malnourished, perhaps from having enough food, but the food one has access to is lacking in nutrients to provide adequate nourishment. Malnutrition is defined as the lack of proper nutrition caused by not having enough to eat, not eating enough of the right foods, or being unable to utilize the food that a person does eat. Malnutrition is often caused by a combination of physical, social, and psychological issues. Severe health conditions impact malnutrition, such as swallowing issues, multiple prescriptions, and cognitive impairments. Many seniors are on a restricted diet, have limited income, reduced social contact, live alone, suffer from depression, and in many instances struggle with alcoholism. It is evident that food insecurity and malnutrition is a growing public health crisis now. In addition, Virginia's senior population is expected to double by the year 2030, which means our public safety net and service delivery systems will need to grow and become more responsive to the unique needs of older food insecure Virginians. So let's dive into the federal nutrition assistance programs that address hunger and malnutrition. Following the Older Americans Act of 1965, the Department of Health and Human Services Administration for Community Living began administering the congregate and home delivered meal programs. DARS, the State Unit on Aging, administers these programs in Virginia, and provides oversight to the 25 local area agencies on aging that implement the congregate and home delivered meal programs in your community. There are also several other USDA programs that we're going to touch on today. The Senior and WIC Farmers Market Nutrition Program, the SNAP program, the Commodity Supplemental Food Program, or CSFP, Child and Adult Care Food Program, and the Emergency Food Assistance Program, otherwise known as TFAP. So the purpose of the Older Americans Act funded nutrition services is to reduce food insecurity, promote socialization, promote health and well-being, and delay adverse health conditions. This is important so people can remain in their homes. Congregate meals are offered in a group setting. They provide 1/3 of the dietary reference intakes and meet the dietary guidelines for Americans. They provide socialization, exercise, and other activities, along with nutrition screening, nutrition education, and nutrition counseling. To be eligible for the program, one must be 60 and over and of greatest social and economic need. Home delivered meals are delivered to homebound individuals. Homebound is defined as someone unable to leave the home to attend regular social activities. They may be able to go to regular medical appointments, but need escort assistance to do so safely. The person is without access to adequate nutrition and for whom transportation to a congregate site is unfeasible. The person must be unable to prepare meals and have no one available to prepare meals for them. These meals provide 1/3 of the dietary reference intake, meet the dietary guidelines for Americans. They also provide an important safety check, along with nutrition screening, education, and counseling, and eligibility is 60 years and over, and for those of greatest social and economic need. So what happened to these programs during COVID? The congregate and home delivered meal programs pivoted quickly in response to the pandemic. Congregate sites were closed and the area agencies on aging, otherwise referred to as the AAAs, ramped up their home delivered meal programs to keep everyone safe in their home. Here's a quick snapshot of that data. There was a 34% increase in home delivered meals served last year. 2,622,000 meals were delivered and 14,413 people were served. DARS was one of the first states in the nation to quickly move the stimulus money out to the AAAs so they could respond to the emergency. You may recall hearing about the Families First Coronavirus Recovery Act and the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act. DARS continues to survey the 25 AAAs frequently during this pandemic to leverage resources as supplies and capacity continues to fluctuate. Over 90% of the AAAs transferred their congregate participants to home delivered meal participants within 2 weeks at the end of March last year. A few programs went to a virtual platform where congregate meal participants picked up their meal curbside. To date, there are 4 AAAs with a wait list for home delivered meals due to capacity limitations, such as they do not have enough manpower to deliver the meals because their volunteer base was reduced. Here's a firsthand look at the data from our congregate and home delivered meal participants comparing 2019 data to 2020. There's a required nutrition assessment completed on all Older American Act nutrition participants, referred to as the NSI, or the Nutrition Screening Initiative. There are 10 assessment questions. All categories of the NSI's Determine Your Health assessment tool showed a statistical increase, except for one which stayed the same, in 2020, such as an 11% increase in I am not always physically able to shop, cook, and or feed myself. Ironically, there was no increase in the number of alcoholic drinks per day, at least not that anyone wanted to admit to. So how does the Older Americans Nutrition Programs align with the Roadmap to End Hunger? The Roadmap to End Hunger wants to maximize federal nutrition program participation and access, invest in a strong regional food system, and empower local communities. And congregate and home delivered meal programs reduce hunger, food insecurity, and malnutrition. They promote socialization and promote the health and well-being of seniors. One of the Roadmap to End Hunger's goals is that home delivered meals for seniors and people living with disabilities will be provided as a Medicaid covered service. Currently, Virginia is one of the few states where home delivered meals are not a Medicaid covered service. This may be in the hands of another department that would need to request a waiver from the Centers for Medicaid and Medicare Services, otherwise known as CMS, which in turn would require additional funding. Although I am definitely not the expert on this, there may be a need for a creation of a multi-departmental work group to bridge this gap. One barrier that must be overcome early on in these discussions is the difference related to voluntary contributions for home delivered meals. It is a federal requirement that meal providers cannot solicit program income or voluntary donations from Medicaid eligible participants, whereas the Older Americans Act home delivered meals programs allow for the solicitation of voluntary contributions, which helps defray meal costs for the AAA meal providers. Another one of the Roadmap to End Hunger's goals is that evidence-based nutrition education programming will be made available to food insecure families in all regions of the Commonwealth. Currently, the AAAs provide nutrition education to their congregate and home delivered meal participants. However, I would say that it has been offered in a less formal way. And recently, the Administration for Community Living began requiring that each state have a separate service standard for nutrition education, which I think is a good thing. The DAR's Office of Aging Services has drafted a nutrition education service standard, which is planned for implementation statewide in the fiscal year of 2022. This will solidify that all congregate and home delivered meal participants are receiving evidence-based nutrition education. To take the Roadmap to End Hunger a step further, starting in 2019, all Virginia AAAs are now required to provide one-to-one nutrition counseling services following the implementation of the DAR's Nutrition Counseling RDN service standard implementation. Nutrition counseling is promoted to all congregate and home delivered meal participants. A referral for nutrition counseling is triggered from an assessment where participants score as high risk on that Determine Your Health Nutrition Screening Assessment tool and answered yes to the following question. Without wanting to, I have lost or gained 10 pounds in the last 6 months. So the next program we'll discuss is the Senior Farmers Market Nutrition Program. For clarification, my position at DARS administers both the senior and WIC portions of this program congruently. Today, we are mostly focused on the senior portion. SFMNP provides low-income seniors with checks that can be exchanged for eligible foods at farmers markets and roadside stands. The purpose of the SFMNP is to provide fresh, nutritious, unprepared, locally grown fruits, vegetables, and herbs from Virginia farmers. This program also has a federal requirement that nutrition education be provided to the participants of this program. So that goes along nicely with the Roadmap to End Hunger's goal that evidence-based nutrition education programming be available to food insecure families across the Commonwealth. So this program is a USDA annual grant. It runs from June 1st through Thanksgiving. 10 out of 25 AAAs participate due to funding limitations. In 2020, there was $113,000 of food funds provided to Virginia, and the program served 10,282 seniors. DARS has cooperative agreements with the Department of Agriculture and Consumer Services, or otherwise known as VDACS, the Department of Health, and the City of Emporia. The redemption rate in Virginia was 87% this year. That is above the regional redemption rate and the national redemption rate. Virginia's SFMMP redemption rate is consistently higher than regional and national averages. There were 207 farmers participating this year, which is an increase from 193 in 2019. 62 farmers markets, which was increased from 58 last year, and 31 roadside stands, which was up from 24 from last year. As you can imagine, this program had to make COVID pivots this year that included curbside pickup, online ordering, aggregating and drop-offs at senior housing facilities. So as mentioned, Virginia has 25 area agencies on aging, but only 10 agencies and 1 city participate in this program. DARS receives daily calls from the public wanting to participate. The funding is from USDA only, and Virginia's success is based on grant utilization. So although Virginia has a high redemption rate compared to the regional and national data, Virginia has to return the unutilized food funds as compared to other states that have some state funds, because they can use the 100% of the federal funds first before any state funds get used. So the roadmap says expand senior and WIC farmers market nutrition programs statewide, increase the number of SFMMP outlets in Virginia from 10 area agencies on aging to 15 out of the 25 total, serving high need populations. Increase senior and WIC FMMP authorized farmers and farmers markets throughout Virginia by expanding from 5 growing regions to 6 growing regions out of 6 total. Increase the number of authorized growers in the areas identified as food deserts. WIC and senior farmers market nutrition programs will be available at all highly accessible high-need farmers markets. And some additional barriers we have to think about is that VDACS and DARS staffing capacity could be an issue. I want to touch on the Virginia Fresh Match program here. Virginia Fresh Match is a statewide network to help farmers markets serve low-income shoppers. Virginia Fresh Match's incentives double the value of federal nutrition benefits like SNAP and increase consumer purchasing power so individuals and families with tight food budgets can bring home more Virginia-grown fruits and vegetables. Farmers markets are on the rise in Virginia, with more than 250 locations selling everything from peas to peaches. Half already accept SNAP. But while Virginians spend over $1 billion a year in SNAP, only 0.2% goes to farmers market. That was about $200,000 in 2019. When more SNAP money is spent on local produce, everyone benefits. So the roadmap to end hunger states that Virginia Fresh Match and the WIC and Senior Farmers Market Nutrition programs will be available at all highly accessible high-need farmers markets. Currently, there are 79 SNAP authorized markets that work with Virginia Fresh Match. Of those 79 markets, less than half also accept the Senior and WIC Farmers Market Nutrition Program coupons. These two programs need to work in unison to remove barriers for participants, farmers, and farmers markets. One big barrier is technology and connectivity access. As Virginia Fresh Match, and SNAP utilizes the electronic benefit transfer, otherwise known as EBT. Next up is SNAP. The SNAP program is operated by the Department of Social Services. SNAP provides nutrition benefits to supplement the food budget of needy families so they can purchase healthy food and move towards self-sufficiency. In 2020, there were 4 AAAs out of the 25 with SNAP outreach contracts, and that's down from 5 in 2019. These 4 AAAs received a total of about $52,000 from DSS, which is down from about $82,000 in 2019. These AAAs provide outreach through care coordinators, assistance with eligibility pre-screening and application process, and they promote SNAP at community events, senior centers, and senior living facilities. Currently, 75% of eligible Virginia seniors participate in SNAP. One way to begin aligning with Virginia's Roadmap to End Hunger's goal of 90% participation is to increase the AAA's contracts with DSS as SNAP outreach service providers. There needs to be more informational sessions on the benefits and barriers of providing this service. The next program up is the Commodity Supplemental Food Program, or CSFP. This program is operated through the Department of Agriculture and Consumer Services, and its mission is to improve the health of low-income older adults at least 60 years of age by supplementing their diets with nutritious USDA foods. Eligibility of CSFP is for low-income seniors 60 and older at risk for malnutrition. It currently serves its maximum caseload of 10,801 people. It provides supplemental food, recipes, and nutrition education. It is administered by the Virginia Food Banks. Each box has a retail value of $40 to $50 and will contain items such as protein foods like beans, cheese, canned meats, and it also has pasta, sauce, oils, flour, canned and fresh fruit, canned vegetables, ultra-high temperature pasteurized milk, cereals, rice, and more. Recipients may pick up boxes at their local food distribution center or arrange for home delivery. Blue Ridge Food Bank and Feedmore each have 28 distribution locations, and 3 AAAs participate in the distribution process of this program. The current caseload for this program is maxed out, so to align CSFP with the Roadmap to End Hunger, the caseload would need to expand. Then we need to connect more AAAs to CSFP and their distribution sites. An awareness campaign can be incorporated into the care coordinator's outreach arsenal to explain more about the program to the participants. Next up is the Child and Adult Care Food Program. This is operated through the Department of Health. CACFP provides year-round supplemental federal funding to eligible adult care centers, child care, family daycare, Head Start, at-risk after-school care, and emergency shelters. This funding is used to provide nutritious meals and snacks to lower-income participants at these care programs. From my research, it looks like 37 adult day programs out of 71 utilize the CACFP. And this includes 4 of our AAAs. The Roadmap to End Hunger wants to increase sponsor and site participation in CACFP for the adult day programs. This can be done by providing outreach and program information on CACFP to the adult daycare providers and to the AAAs. The last federal program we'll discuss is the Emergency Food Assistance Program, or TFAP, which helps supplement the diets of low-income Americans by providing them with emergency food and nutrition assistance at no cost. It provides food and administrative funds to states to supplement the diets of these groups. This program is offered through food banks, who distribute food to food pantries and soup kitchens. To align with the Roadmap to End Hunger's goal of Virginians will have streamlined access to food security information and benefits programs, we can first provide education to the AAAs about these federal programs to determine barriers to participation. Then we can ensure referral programs at AAAs include information on how to access this program. And then number 10 of the Roadmap to End Hunger's top 10 list is that a statewide network of hunger action coalitions will be established to advance the goals of the Virginia Roadmap to End Hunger and to identify and address local opportunities for improving food access. One that I am highlighting and that DARS has some involvement in is the Virginia Food System Council. The Virginia Food System Council states that our food system will thrive only when every person within that system can easily access and utilize healthy, culturally appropriate foods. All who want to farm should be able to access land, grow, harvest, sell, or add value to foods. The Food System Council value a food system that prioritizes people and communities who historically and systematically have not been able to reach their food and agriculture related goals based on race, class, gender, sexual orientation, ability, and other forms of discrimination. They value a resilient food system that provides consistently high quality food for all. To reach this as a council, they prioritize uplifting individuals who have been most impacted by historical and systemic injustices by including their leadership as part of the council and listening to their particular needs and experience to help shape the council's vision, needs, and goals. Virginia's just and equitable food system will support everyone based on their own needs, especially when there are environmental, economic, and societal challenges. So in conclusion, there is plenty of work to be done to advance the federal programs that we administer and to help align them with Virginia's Roadmap to End Hunger. We can focus on home delivered meals for seniors and people living with disabilities that could be provided as a Medicaid covered service. We will continue to advance the evidence-based nutrition education programming that is made available to food insecure families in all regions of the Commonwealth. Virginia Fresh Match and the WIC and Senior Farmers Market nutrition programs will be available at all highly accessible high-need farmers markets. The SNAP participation rate will reach 90% of eligible individuals or higher. And Virginians will have streamlined access to food security information and benefit programs. And there is a list of the references used, and then my contact information. And thank you. I think we'll open it up for questions.
Wonderful. Thank you so much, Kelly. I think it was very informative, a lot of information, and we have some good questions coming in. I'm going to allow Stephen Sheeb, and I apologize if I butcher names, to go ahead and unmute and go ahead and ask your question you've submitted.
Well, basically, we have a food pantry in our church, and because all the volunteers, both checking in and distributing food, are in the age group, we're very hesitant. We've been closed since last March, and unless we feel that we can't function as a food pantry and distribute food to those in need until we're all inoculated with the COVID vaccine. So that's more of a statement than a question, I guess.
It's a great statement, and I totally feel your pain, and that's part of the dilemma with the pandemic is many programs have had to close or shift, which is putting people more at risk for hunger. Sure. Thank you for sharing.
Absolutely. So just a reminder, if you have a question you'd like to ask, If you could put your question in the Q&A box, or you can click the raise hand icon at the bottom of your screen, and we can allow you to unmute yourself and talk directly with Kelly. Our next question comes from Michael Perrell. You can go ahead and unmute yourself and ask your question.
Hi. If you can hear me, hopefully.
Yes.
One survey in your presentation indicated that 25% of the respondents did not have enough money for food. And given that, do you have any thoughts on the pros and cons for all the volunteer efforts to reduce food insecurity, and the trade-off being, is it better to donate food to food banks and other places as opposed to somehow donating money to let the people who don't have enough money use it directly, and hopefully with all the education they're getting, buy the right nutritious, healthful food?
That's a great question. And I certainly don't have all the answers to that. All I can pull from is my experience when I worked at the food bank in Central New York. And they definitely advised people that wanted to help to donate money to the food bank so that the food bank could purchase, because they have a huge buying power across the whole nation, that they could purchase the healthy foods and then use their delivery systems to get it into the hands of the folks who need it. So that would be my recommendation. Great question.
Thank you, Michael. Our next question was put in the chat box by Dan Caro. And Dan, if you could go ahead and unmute yourself and clarify your question, because I'm not sure exactly what it refers to.
I was just interested in which of the 10 AAAs are actually involved in the SM program.
That's a great question. Let's see if I can rattle them off. Mountain Empire, Appalachian Agency, District 3, VPAS, Senior Services of Southeastern Virginia, Eastern Shore. How many am I up to? Arlington, Southern. I missed anybody? It should be close to about 10. Did that answer your question? Was there one in particular you wanted to know if they are participating or not?
Yeah, actually, I was looking at the Jefferson Area Board of Aging, JABA.
JABA. That's a great question. And no, they do not participate at this time. Thank you for asking. We'd love to get it into all the AAAs.
Oh, all right. Our next question is going to come from Tony King. You can go ahead and ask your question, Tony.
Good afternoon. I missed this. How can someone access the Senior Farmer Market Nutrition Program? The grant?
How can someone, like a participant?
Well, I'm a medical social worker.
Or a AAA?
By Senior Services? Is that what you're saying?
You broke up on me.
Yeah. How can I have my seniors access or some?
I think I get your question. I lost you again, but what you can do is refer to your AAA.
Okay.
They know whether they have the program or not. If they do have the program, they can make sure, they can tell you how they sign participants up. So it's done at the AAA level.
Okay.
So that's my suggestion. Reach out to your AAA where the participant is located.
Okay, thank you.
You're welcome.
All right. Our next question is from Susan Castle. You can go ahead and unmute yourself, Susan.
Hi, can you hear me?
Yes, ma'am.
Okay, so
Yes.
I am an employee of Peninsula Agency on Aging, and I have asked in the past about getting the Senior Farmers Market Nutrition Program, and perhaps I've misunderstood, but it was my understanding that it was locked into 10 AAAs and that there was no opportunity to open it to other agencies. So you're saying this roadway would open it to 15 agencies. So my question is, when will the SFMNP program be open to other AAAs such as mine?
That's a great question. Thank you for that. So moving it from 10 to 15 is a goal, one of the top 10 goals of the Roadmap to End Hunger. And how that's going to happen is several ways. One is we need to see some increased funding. And then we also have to make sure that our partners at VDACS, the Department for Agriculture and Consumer Services, have the capacity to help, because they provide the training of the farmers and the monitoring of the farmers in the area where these farmers markets and these programs are. So I have a couple ideas up my sleeve, and we'll be meeting with VDACS to see what their plan is and how we can move it forward. But right now, there's no set deadline on if and when that's going to happen. It's a conversation that goes way beyond me, but we need to keep having. But thank you. I'd hope to get it into your area. You have great farmers markets there. I live in that area.
All right, at this point, we don't have any more questions. Again, if anybody has any questions, oh, we have one come through. And let me go ahead and let Elise unmute. Elise, you can go ahead and unmute yourself and ask your question.
Over I guess the last 2 years, I've heard a couple of times, and I work for social services, and in meetings I've heard that they are going to increase the minimum for anyone who's age blind or disabled. Right now it's $16 a month for SNAP. And many of our seniors, if they have any income at all, most of them only receive that $16 a month. And it's very frustrating when we ask them to do all these things to stay in the SNAP program, but then they're only receiving that amount. Have y'all heard anything about that increase, or is that on anyone's radar that that's ever going to happen?
That's a great question, and I've heard the same exact thing that you have. The tune I hear over and over is that for all the effort to apply for the $16 a month, it's not worth the participants' efforts. So I'm with you, and I hope that it is being looked into. I have no control over that, but that would definitely, a higher amount would make it more worthwhile. And I think we could get more participants to sign up to reach that 90% goal of the Roadmap to End Hunger. Great question. I appreciate that.
All right, well, at this point, it looks like those are all the questions we have had. And I think, we've had several really good ones. Is there any other follow-up information you want to share before I give some closing remarks?
No, I just want to thank you very much. I've enjoyed this. And if anybody has any questions, feel free to reach out to me.
Okay, well, let me just share. Oh, let's see, we have one more question. Oh, will we get this PowerPoint? So absolutely, we can get it as long as Kelly's okay with us sending it out. Not a problem. So we'll get you all of the information from Kelly. Again, her contact information is listed here, so you're always welcome to reach out to her. We encourage you to put VGCOA webinar just in the subject block so it catches her eye and she knows what it's about. These webinars are recorded each month, and you can always go to our website, vgcoa.com, to see the recorded webinars and to register for the upcoming webinars. February's webinar will be about guardianship, and then March, we're going to be talking about financial exploitation and the Senior Medicare Patrol Program. We are always looking for new webinar topics, and our hope is, even though we started this webinar series to bridge the gap between what was supposed to be the 2020 conference and the 2021 conference, we've had such a success and seen such interest that we plan to move forward with continuing this series once the conference occurs in May. So again, I thank you for being here. I thank all of our partners. I thank our sponsors. We couldn't do it without you. And again, feel free to reach out to me if you have webinar ideas, feedback, if you'd like to volunteer with the virtual conference or interested in supporting the virtual conference. And again, Kelly, thank you for joining us, and we'll see everybody in February.
Thank you.
Thank you.